from ITC Dubai 2026. We're very delighted to be joined by Dr. Omar Sabri, consultant orthopedic surgeon. Dr. Omar, we're very delighted to have you with us here today.
Thank you for having me, Linda. I appreciate the invitation.
Well, Dr. Omar, in 2026, robotic technology has evolved significantly with fully robotic platforms like Cubis actually executing tibial keel preparation with high precision. How do you see this level of advancement?
I'm glad it's finally arrived. I mean, we've been waiting for it for some time. Robotic technology has been around in manufacturing for several years. I mean, we look at the level of detail in the automotive industry, for example. So it was only a matter of time. The level of precision is excellent. The full automation is what was needed. But it's not just the robotic technology or the arms. It's the combination of the pre-operative planning to create something that's very patient specific and then execute it with a fully automated solution. So I think the combination of both is what we've been waiting for, and it looks like it's finally arrived.
And to what extent do you believe that such robotic systems will actually reduce revision knee surgery?
So that's the million-dollar question. Unfortunately, the evidence is not there yet. We know that using robotic technology gives us the precision to be able to implant these modern implants to sub-millimeter and sub-degree accuracy. Okay, that translates to two main benefits. One is in short term, which will see quicker recovery for the patients. But the one that we're still waiting for, the short-term benefit has been demonstrated. The one we're still waiting for is the long-term benefits of how long these implants will survive by being inserted with better precision. This takes 15, 20, 30 years to be able to identify that. But so far, it's promising. The evidence is coming.
Well, knee arthroplasty isn't only about bone cuts, but it's also about soft tissue balance. Do you see that such robotic systems will actually help reduce operative time, as you've mentioned earlier, and also optimize biomechanical alignment?
The short answer is yes, but we have to know where we are now. We've evolved in terms of what we feel is the correct alignment. So if you go back a few years or what we've been used to, unfortunately, knee replacements done conventionally only have an 80 to an 85% satisfaction rate. So patients there's still a big margin of them that are not happy, which is what pushed us to look for better technology and trying to identify where the problem is. So we've moved on now to different alignments, whereas before you just put everybody's knee directly straight. Now we don't. We look at the patient's specific anatomy and we try and reproduce that. So if you want to try and reproduce that, you can't eyeball it. You need the technology to help you to be able to dial in 2-3 degrees, right? You can't do that with your eyes. So therefore, the new technology helps us get to a different philosophy of patient-specific solution. Why? Because we're hoping that this 80-85% satisfaction will drop down and patients will be more satisfied.
If you would send a message to the young surgeons entering the orthopedic industry, what would it be?
The message is get on the robotic or get on the new wave of evolution. This is a natural evolution of orthopedics and engineering combined together. I think you have to get on that wave really early in your career, believe in it, and then push forward, push through the boundaries. Don't believe in the dogma that my hands are better, my eyes are better. They're not. Okay? Get on that train really early during your career, and you'll reap the benefits later on.
And if you would send a message to OrthoHouse, what would it be on the occasion of it being the scientific leadership partner of ITC Dubai 2026?
I think that what they're doing is really impressive. I think they've embraced the technology side of things, and they're certainly doing things a bit different. They're not launching an implant or a plate or any particular hardware without providing the modern instrumentation or the modern robotic assisted solution to put these implants in. And I think the fact that they've adopted that really early from their launch is really impressive.
Dr. Omar Sabri, consultant orthopedic surgeon, thank you so much for being with us here today.
Thank you for having me. I really enjoyed it.
Thank you.